Well, it's been a week of good news and bad on many fronts. The good news for this show is that you don't have to hear me weigh in today on the absurdity of AG Bill Barr authorizing investigations into Donald Trump's unfounded voter fraud claims, or this alternative reality statement from Secretary of State Mike Pompeo.
There will be a smooth transition to a second Trump administration.
Now, the bad news is that others have actually had to waste time trying to figure out whether Pompeo was joking, as though an attempted coup is a laughing matter. As for the ongoing pandemic, the good news is we have another approved antibody treatment that the FDA signed off on, plus those early results on Pfizer's vaccine indicating a 90% effective rate at preventing COVID infection. The bad is that we've passed the 10 million mark of confirmed COVID cases nationwide, with more than 1 million coming in just the last 10 days alone. Overall, we're seeing more than double the number of cases we were at the end of September, with hospitalizations up 25%. And Trump's refusal to concede the election is only complicating efforts to control the virus's spread, as Massachusetts Governor Charlie Baker called him out for today.
I can't think of a worse time to stall a transition than amid a deadly pandemic, and what this president is doing at this point in time is not in the best interest of this country. And I hope that a new administration can help remove the partisanship from this fight against the virus.
Here in Massachusetts, where we've seen more than 1,000 new confirmed COVID cases almost every day for more than 2 weeks, and more than 2,000 yesterday alone, Governor Baker has added some public health measures, including a revised state mask mandate requiring nearly everyone 5 and older to wear a mask while in public, regardless of social distancing. He's also tightened limits on gatherings to 10 people inside, 25 outside, and instituted a stay-at-home advisory from 10 p.m. to 5 a.m. Many businesses also have to close by 9:30, such as recreational facilities, theaters, performance venues, gyms, liquor stores, and restaurants have to stop table service by 9:30, though they can still offer takeout later. But on the other end of the spectrum, the governor announced new guidance strongly discouraging remote learning in schools, encouraging full in-person learning in most communities as feasible, and hybrid learning only for districts in the red. As of last week's report, only 16 cities and towns in Massachusetts were in the red after the state revised the data it uses to determine risk levels. Before that change, more than 120 communities had been deemed high risk. Really? So if you don't like the numbers, you just change the math? Still, Governor Baker said today the state is getting ready for cases to keep rising, adding ICU beds and planning for field hospitals in the not-too-distant future. I'm joined by William Hanage, an associate professor of epidemiology at Harvard's Chan School of Public Health and a member of the school's Center for Communicable Disease Dynamics, and Dr. Cassandra Pierre, acting hospital epidemiologist and medical director of public health programs at Boston Medical Center. Welcome to both of you.
Hi, Jim.
Let's start locally if we can. So the governor is limiting indoor dining. He's not shutting it down. He is putting a curfew in place, but it's voluntary. Dr. Pierre, starting with you, is that bold enough considering the increasing numbers we're seeing?
I don't think it's bold enough, to be honest. I think the concern here is that many people think that what's open is safe. And I've certainly seen enough people, patients, colleagues, who have gone into restaurants or other indoor areas, to be honest, at places like gyms, believing them to be safe, and unfortunately becoming infected. And I just think there's not enough awareness that because a place is open does not necessarily mean that it is safe.
You know, Bill Hanage, curfews, even those that are mandatory that I've read about around the rest of the world, have been false hope things. They last for a week, maybe two, followed by lockdown. So is this enough coming from the governor?
I think you're absolutely correct. We have actually quite a lot of data on curfews from around the world, and it's very difficult to find a place that has put in a curfew and has then managed to be able to avoid more intense action at some later date, a lockdown or getting closer to a lockdown. I would just echo exactly what Dr. Pierre was saying. I mean, we have here a situation where it's not like the virus suddenly kind of looks at the clock and says, oh, it's after that time, I'm not going to transmit now. No, we are reducing some of its opportunities for transmission, but not enough.
So does that mean that indoor dining should also be shut down, not just this scaled down kind of thing, starting with you, Doctor?
Unfortunately, I hate to say it. I hope I don't get hate mail, but I do think that it is probably prudent at this point. Our numbers in our community are rising, and unfortunately, it's happening and accelerating a little bit faster than we thought possible right before the holidays. I think as we go into the holiday season, more people coming in into indoor gatherings who have been out to restaurants, who have been in other indoor locations, they will unfortunately bring the virus with them.
Bill Hanage, do you agree with that? And if you do agree with that, what should the governor be doing?
Well, I want to start by pointing out that the governor does deserve credit for having done things and opened cautiously in such a way that we are increasing from a low level. However, let's get real. We are increasing, and we are increasing quickly. And those increases in case numbers are going to be translated into increases in hospitalizations and sadly deaths. And like we just heard, we're hitting the holidays. We're heading to Thanksgiving. Now, as for whether or not indoor dining should be stopped, I'll point out the example of the Netherlands. The Netherlands tried a number of things, including curfews, and ended up with our hospitals overburdened to the extent that they were airlifting patients to Germany, which has had a much lower rate of disease, I should point out. What they did eventually was they closed restaurants. They allowed takeout. They allowed people to be able to get their meals to go. They could get their marijuana to go as well, but there was no in-person, indoor dining. And a few weeks later, it's always hard to tie things absolutely causally. A few weeks later, cases were down.
So step one would be to shut down indoor things like dining where people gather, shut them down. So if these measures taken by the governor are not bold enough, it seems to me that that may undercut his thesis that the protections we're putting in place are what allow us to have in-person learning in our schools. Am I right about that calculation, Dr. Pierre, or am I missing something?
You know, certainly we would have to take a look at the data to prove out with time whether this has been effective or not, whether putting an emphasis on the mask mandate and the curfews actually show some improvement or slow the spread. But I do think that the ongoing, and again, it's not just restaurants, I don't want to single them out, but other indoor activities place in-person schooling and other activities at risk.
You know, Doctor, I want to stay with you for a second. It seems to me that while we're talking about the governor, because he's the only one that can put in place dramatic measures, and we'll see if they work, it seems there's a Pogo-esque situation here, too, that we are part of the problem. I mean, you see patients that, do we get it? Do we really understand what's going on? And I don't have to finish my question. I can see you shaking your head. No, what are we missing?
Yeah, what we're missing is the risk we pose to each other. There is still a very strong us versus them, us meaning anyone in your community, your work group, people that look, act, or think like you. It happens everywhere. We feel more comfortable. We let down our guard. Mm-hmm. We know that COVID fatigue is a reality as well, but I think that people continue to have gatherings with family and friends, people they haven't quarantined with, and that continues to put us at risk.
You know, Bill Hanage, let's move to the vaccine front. There was basically exultation throughout the land yesterday when Pfizer came out with their information. Even people like Anthony Fauci seemed to be, and I don't mean even in a critical way, I mean a cautious guy like Anthony Fauci, seemed to feel positively. You said, I don't know if you tweeted or you said, I read it somewhere, this is not definitive. What did you mean by that?
What I mean is that it's an interim analysis. It means that we don't have all of the data in yet, and it's not something which other scientists have been able to pick over. We don't know yet whether or not it's going to be equally effective in all age groups. As we know, it's the older age groups that are most severely affected. We also don't know definitively yet whether or not it's going to be good at stopping severe disease, which would be good, or stopping transmission as well, which would be better. So there are lots of things we don't know. And crucially, it has to be kept really cold. This is one of those vaccine candidates for which the cold chain is really important. And that's going to be a really crucial thing of just the logistics of rolling it out.
Well, let me stay with you for a second. Let's assume, and I rarely take the optimistic position on anything relating to the coronavirus, but let's assume that it is 90% effective and it is pretty much across all demographic groups. Do you have confidence that Operation Warp Speed has the ability to distribute this, do what you said, keep it as cold as it's got to be, ensure that people get a second dose of most of the vaccines would require a second dose that are in third stage trials, that the second dose be of the same vaccine? Are you confident we have that capacity?
Well, the first thing to say is that this vaccine has been developed independent of Operation Warp Speed. Pfizer
right.
Independent. The logistics of being able to get it out, I'm not fully confident. I mean, I think that it will happen eventually, this or any other vaccine. And it's important to note that there are many other vaccines in development.
Yes.
And some of them may be superior under certain circumstances. We're going to find out a lot more over the next month or so.
You know, Dr. Pierre, the reason why I developed extreme cynicism about the distribution mechanism of Operation Warp Speed was not just the fact that this administration has botched virtually everything they've touched, either through inaction or wrong action, maybe except the speed of vaccine development. I don't know if you saw 60 Minutes the other night. Here is General Gus Perna, who was in charge of Operation Warp Speed. Listen to what General Perna had to say.
I listen every day to what's being said, and then I spend a good part of my evening Googling these words so that I can participate, preferably at an intellectual level, but at least in an understanding.
I thought it was like a joke. I go home and I Google the words that I don't understand so that I can participate in an intellectual level. Are you confident that the infrastructure is in place, assuming we get good news not just on the Pfizer vaccine, but on the other almost dozen, that we can actually get it out to people?
Well, hopefully he's also looking at medically approved sites, and that would actually be a step up, just FYI. But in terms of distribution and infrastructure and what our confidence is, I think our confidence is low, given our history. Now, there are many places where the infrastructure for vaccine development and deployment is well stood up already. Massachusetts is one of those places. But we also have to contend with vaccine skepticism. That's the other part of the equation. So as good as our vaccine deployment may be, we also need to know how many people will be willing to become vaccinated.
Well, can I stay with you for a second on that? I was under the false assumption that what people like you have to do is set an example. Our leaders, our political leaders do too, and then hopefully, ultimately, the skepticism, other than the really nutty anti-vaxxers who facts will never convince. On the same 60 Minutes story, the public health commissioner, the health commissioner from New Jersey said a survey they did, get these numbers, only 60% of the doctors and only 40% of the nurses in New Jersey said they would take the vaccine. They're the role models. How is it possible that we're expected to take it at 70% plus levels when the healthcare professionals don't even get it?
Yeah, your extreme cynicism is unfortunately infectious. Many people have seen what's been happening with this administration, all of the wrong steps that have happened, and have developed this sense that they can't trust what's being said and being told to them. I think that really the people who are engaged in looking at this work and evaluating it need to take that information and be role models, but we also need to work with trusted community advisors and leaders as well, because just being public health, even if all of us decided to do it, probably still wouldn't be enough.
30 seconds, Bill Hanage, if you can. What do we do to change the public education on this vaccine reluctance or hesitancy issue?
Well, there's this very virulent thing among us, and it's misinformation. Misinformation on the internet is widespread, like we were just hearing. Following Google is not necessarily the right way to go. What you should do instead is we need to put back in place these trusted public health authorities, people like Dr. Fauci. And that's one of the most important things that the president-elect is going to be able to do. But I want to point out, unfortunately, there's quite a long time before the president-elect is going to be able to do anything other than set a good example.
Bill Hanage, Cassandra Pierre, I really appreciate your time and your thoughts. Thank you to both.
Thank you.
Thanks for having us.
Be well.